Good afternoon, everyone. Welcome. I'm Avital Havusha. I'm the Vice President for Programs here at the NYHealth Foundation. Thank you so much for joining us today to discuss how the new federal administration could impact New York's public health insurance landscape and efforts underway to protect and preserve our programs. So before we get started, I just wanted to share a few housekeeping items. We'll be recording the webinar, and a recap with the link to the recording and other materials will be circulated after. Your video and audio as attendees is disabled, but we invite you to use the chat box throughout the event. I'll be monitoring questions, and after the presentation and some discussion, we'll try to get through as many as we can. And for those of you who would like, there's also a closed captioning feature available at the bottom of your screen. So to kick us off, as has become our new reality, we are hosting this event at another moment of rapid changes and uncertainty. There's been a lot of action even in the last 24 hours that we'll try to address. And as you all know, New York has really built a robust system of public health insurance coverage. It is the backbone of promoting healthy and equitable communities here in New York. But the system is now under pressure, and proposed cuts pose immense risks to access, quality of care, and long-term health outcomes. While these challenges are really significant, there is so much strength in the partnerships and collaborations here in New York, many of them represented here today, from state and local government to providers, think tanks, advocates, and community-based organizations. We really have a deep bench of dedicated leaders who are responding to protect our programs. Today, we'll do our best to recognize the complexity and the magnitude of this moment without causing confusion or panic. We likely won't have all of the answers to your questions, or our own questions, actually, especially related to some of the most recent activity this weekend. But we are hoping that you'll leave today with some clarity on the status of things today and how you can get involved. So before we dig in, I'd also really like to just make sure we ground ourselves in what's at stake. As we all know, insurance coverage, including Medicaid, are so much more than budget items. They're really a lifeline for older adults, children, people with disabilities, low-income communities, among others. And their stories are really central to our discussion today, and we'll be trying to bring those to the forefront. But I really did want to ground us in a few. And so just in terms of some of those stories that have come out from the advocacy over the past few months, I want to share a few. So one from one mother who shared, Medicaid is critical for my son's early intervention services. Without Medicaid, my son certainly would have regressed. To families like mine, Medicaid is a lifeline. Or another person living with disabilities who shared, personal assistance from Medicaid keeps me out of the nursing home and ensures that my friends with similar needs can live in freedom. And finally, someone who has lost employment recently. When I lost my employment a few years ago due to work injury, I lost my health insurance. I was able to apply for Medicaid, which assisted with the cost of my insulin and diabetic supplies. Without my medication, I would not have been able to survive. And so those are just a few of the stories I want us to keep on the forefront as we go through our presentations today. We have an excellent group of panelists and so much to cover. I'm pleased to welcome them here and honored to have them join us. And really also wanted to thank some of our partners at the Robin Hood Foundation and the Health Foundation for Western and Central New York, who have also been supporting some of their efforts. So first, Elizabeth Benjamin, who's the Vice President of Health Initiatives at the Community Service Society, Lara Castle, the Coalition Coordinator for Medicaid Matters New York, and Alice Lamb, who's the Managing Director at Manat Health Strategies. And I'm going to kick it off first to Alice, who's going to walk us through some slides to ground us with some of the facts. And then I will pass it off to our next presenter. So if everyone could bear with me, I'm going to just share my screen. Let's see. Okay. Okay, Alice, I'll turn it over to you.
Great. Thank you for that introduction, Avital. And it's a privilege to join you and our panelists and audience members today to talk about the federal actions that we are all tracking closely and the impact they have on New York's public insurance programs. So go to the next slide first. So what are we talking about today and what's at stake? We're here because the administration and Congress are considering a number of federal policy changes that, if enacted, could have significant impact on the structure and the funding of New York's Medicaid program and our other vital public coverage programs like Child Health Plus, the Essential Plan, and Qualified Health Plan coverage through the New York State of Health. More than 9 million people access their healthcare through these programs today, and their healthcare and the healthcare delivery system that supports them in New York would face very significant consequences if changes were enacted. What we're seeing is potential changes to federal Medicaid funding that would significantly intensify the financial pressure that the state faces, and also could lead to downstream impacts for enrollees, for providers, for health plans, and the state economy more broadly. These cuts to Medicaid would also terminate health coverage and access for the millions of Medicaid enrollees who rely on this coverage. And we know that coverage footprint is vast. Medicaid pays for care for seniors and long-term care, for children, for people fighting cancer, people with disabilities, veterans, workers who can't afford insurance, American Indian people and families in rural areas as well. Medicaid work requirements are being contemplated, which we know lead to substantial coverage losses, add to administrative costs for the program, and also significantly reduce access. They don't really help to promote employment, but they make it harder for people to stay on coverage and to be healthy enough to work. There are also a number of other federal actions that have been taken or are being contemplated that we're watching closely. These include changes to access to coverage for immigrants, changes to federal authorities that are really critical for New York's public coverage programs like the Section 1115 and 1332 waivers that we'll talk a little bit about as well. And they could have really significant impacts in terms of how Medicaid and other state coverage initiatives and New York State's delivery system works. If these federal funding and policy changes do advance, New York will be faced with options for responding. But those options include looking at coverage and benefits, looking at payment rates to plans and providers, actions that could lead to more significant coverage losses, reduced funding for providers and plans, and higher uncompensated care in terms of our economy. And so we'll talk a little bit more, and I'll give a little bit more of the flavor of some of the potential actions in these next few slides. So we're going to start first with some of the potential actions that have been being contemplated on the Medicaid and Child Health Plus program. There are potential changes that are looking at restructuring the federal share for Medicaid and penalizing states that cover immigrant populations using state-only dollars, as well as the way that actions to restrict the way that state Medicaid programs finance the state share of Medicaid costs. Some of these contemplated changes will require legislation to enact. Others can be done via legislation or executive action, as in changing regulations through the federal executive. And we are in a very dynamic moment, as Avital alluded at the start, that we have seen some draft bill language from the House Energy and Commerce as of late last night that is going through markup tomorrow. And this is, widely anticipated language after there were reconciliation instructions that were passed earlier this year. And if these terms still sound foreign to you, Elizabeth will be going through that in her section, sort of doing a little bit of a walkthrough on reconciliation, what that looks like, what the key steps are, and why it matters in terms of a procedure to understand in the legislative process, as well as diving into some of the more specific proposals that we are seeing through that bill draft and some of the significant impacts as it relates to coverage losses and other operational and people impacts on work requirements. So just foreshadowing a little bit that we're going to do a little bit of a deeper dive on some of those aspects. So but my job here is to give a little bit more of, what's been under discussion and what's been sort of on the menu that could happen either legislatively or administratively. And what you see here also with the red star and trying to catch up with the latest activity is some of the things we've seen materialize already through the bill draft that's been released as of late last night. What the Manat team has been doing is to really track what the potential actions are under discussion, as well as their funding impacts. And, in general, we have been sourcing to the Congressional Budget Office, the official scores of federal legislation. They provide national estimates of proposed legislation, as well as using sources like the Kaiser Family Foundation and Urban Institute and New York State data on federal program funding to get more of a New York view into the level of federal funding impact of any one of these actions to New York State. We've also been engaged in, through a Robert Wood Johnson Foundation initiative, state health and value strategy, and doing some more focused modeling that provides a 50-state estimate of some of these impacts. And we've tried to cite to those as well where available. And that's where you'll see across the slides that I'm going to be talking through, the estimated federal funding loss to New York State. So again, this is not speaking to necessarily additional New York State actions, but just what does this federal action mean in terms of federal funds that would no longer be going to New York State and the magnitude of that. And so what we see here in this first slide is a set of Medicaid and Child Health Plus financing proposals that have been discussed. And some of these, again, that we are seeing in bill language that is actively being discussed and marked up at the federal level. There's been a lot of discussion in these first three rows about changes to the federal matching rate for New York State and other states, and with respect to the federal matching rate for the Medicaid expansion population, or the general matching rate, or capping federal Medicaid funding through a per capita cap proposal. And you see the range of estimates there with the focus on what that might look like in terms of New York State impact, ranging from 48 billion over 10 years to upwards of 218 billion over 10 years in terms of the estimated loss of federal funding to New York with the implementation of any of these proposals. We have not seen that materialize in the bill draft that we are seeing right now, which is some good news in terms of the level of discourse that has been had about the impact of these proposals, not only the financial impact, but also the significant coverage impact that they're expected to have. But I think this is another area where it will be important to continue to watch, but wanted to give a sense of what we're seeing here and what the New York level impact could be. Some other financing proposals that have also been identified and some have made it into that bill draft are penalizing states for using state-only dollars for funding health coverage programs for immigrants. And the penalty comes in the form of reducing the federal match rate for a Medicaid program, and in particular, the proposal that we're seeing come out of the House Energy and Commerce bill draft is around the match rate for the Medicaid expansion population. And by our estimates, that reduction that is being contemplated and proposed would mean at least a $1 billion federal funding loss to New York State a year. There's also been discussion of potential reduction of federal funding for emergency Medicaid services that every state provides, which is a fairly significant magnitude. And I think I saw a question come up about what that means. It means we don't have the exact New York State number, but we know that that would be, a reduction in current federal funding to the state in terms of the level of impact there. And then there are a number of changes that have been also raised around how a state finances their Medicaid program and changes related to provider and managed care organization tax authority and state directed payments. These, do also have significant impacts in terms of potential um, federal funding impact to New York State. And what we are seeing emerging in that bill package as well is, changes with respect to New York State's managed care tax authority that the state has currently authorized, as well as potential changes contemplated around state-directed payments, which are, again, important sort of ways in which our Medicaid providers are funded in New York State. We'll move to the next slide, which focuses on new conditions to qualify for Medicaid and other changes to eligibility and enrollment as potential actions to, again, reduce federal spending. And you see a set of red stars here because we are seeing all three of these in the current House Energy and Commerce Bill draft. The first of which is a mandate for states to implement work requirements as a condition of Medicaid eligibility for a set of Medicaid members. The estimated impact of that, and again, Elizabeth will go into far greater detail in terms of the impact of this type of requirement and what it means, is though 72 to 220 billion over 10 years. So it does matter sort of how it gets implemented, what the features are, but our range of estimates and looking at what the potential could be, you see here in terms of that level of impact for New York. The other changes that are also included in the current bill draft and have been discussed are around repealing a federal regulation that was finalized by the Biden administration to help to streamline Medicaid and Child Health Plus eligibility verification and enrollment processes, and also to support coverage and maintenance of coverage. That is also being proposed to be repealed under the House Energy and Commerce Committee proposal. Again, we don't have a New York State estimate available at this point in time, but we do see a national estimate with a projected Medicaid spending decline of 170 billion over 10 years. That was released earlier last week in terms of some initial numbers. And then finally, we're also seeing more frequent checks on eligibility and changes to other longstanding eligibility rules in terms of the Medicaid and Child Health Plus programs, all of which would have the effect of dampening Medicaid and CHIP Plus enrollment and increasing churn on the programs. We'll move to another area in our Medicaid program, which relates to our 1115 waiver. New York's Medicaid 1115 waiver, which includes also our amendment that was approved last year, the New York Health Equity Reform Waiver, is also an area that might be at risk now and when New York renews the waiver in 2027. I'll spotlight three areas here where we've seen some actions and also try to break down some of the impacts. The first of which is around health-related social needs services. So this is the authorization that New York State received to help to cover services that address social determinants of health that are underway and being implemented by a number of different stakeholders in the state, and the social care networks and others are doing a great deal of work in terms of building up capacity in the community and helping to support screening and referral for these services. That component is authorized through the 1115 waiver. There was guidance that was recently released by the Trump administration that would rescind the guidance that allowed for HRSN services to be approved under 1115 waivers, and provided that framework. And stated that this administration's federal agency, the Centers for Medicare and Medicaid Services, that provided that authority, would be looking at approval of this type of authority on a case-by-case basis. We know that rescission of the Biden era guidance, though, does not negate the existing approval, and New York continues to advance in terms of implementing the program, is authorized to receive $1.7 billion in federal funding for supporting these HRSN services, both in terms of the capacity components and the services components. So this is an area where, what will happen at waiver renewal remains to be seen. This authority does continue today, but there was some recent action in terms of rescinding the Biden era guidance. A next area is around designated state health program authority. This is a slightly more technical authority. I think the important takeaway here is it's been an important feature for how New York State finances the federal waiver. And the recent action that was taken by the Trump administration was to note that it would no longer be approving any new requests or renewing any existing requests for this designated state health program authority. So we know that, again, New York's current authority continues, but in terms of its ability to leverage this financing authority at the renewal of the waiver, that will no longer be a route that is available. And this authority today allows New York to be able to access about $2 billion in federal financing to support the waiver itself. And then I'll spotlight one final area that we're watching on the waiver, which is the continuous eligibility component, which provides for has been an important policy for New York in terms of providing both adult and child continuous eligibility. The Trump administration and congressional Republicans, as even seen with the actions that I just spoke to a little bit earlier on what we're seeing in the House Energy and Commerce bill, has indicated they are interested in more frequent eligibility checks and changing eligibility conditions, among others, which are then, counter to continuous eligibility policies. So this is an area where, we're watching it. We don't quite know what will happen. New York has had longstanding authority under the waiver to provide 12-month continuous eligibility for adults. Also, New York received, more recently, authority to provide multiple year continuous eligibility for kids from up to age 6 through for Medicaid and CHIP. And these are both authorities that were authorized under the 1115 waiver. So an area to watch, since we know this policy area is an area that's been under scrutiny at the federal level. So I'll round out just with one final component of New York's public coverage landscape, which is our essential plan and qualified health plans. And access and affordability through our marketplace, the New York State of Health, is also an area that may be impacted by potential federal actions. The Essential Plan covers 1.6 million New Yorkers today, and was something that was implemented as an Affordable Care Act basic health program. New York was one of 3 states to take up that option. Last year, New York transitioned the authority for the Essential Plan to a 1332 innovation waiver, and also received authority to extend the lifetime of that waiver to 2029. We do know, though, that aspects of the Essential Plan may draw scrutiny from both the Trump administration and Congress. And so this is another area that we are keeping a close eye on, just given the footprint and scale of the program in New York, and also some of the key features of the Essential Plan. The other component that I'll end with here is the Qualified Health Plan Program, which covers over 200,000 New Yorkers today. There is currently an enhancement on the premium tax credits that has helped to support improved affordability for consumers. That enhancement expires at the end of this year. We did not see action on this in the House Energy and Commerce bill to extend this further. And if Congress does not act before the end of the year to extend this, the estimated federal funding loss to New York is approximately 480 million in the first year, and also the impact on of enrollees who would decline to likely renew their coverage because of the less extensive tax credits is estimated to be about 50,000 individuals who would no longer be covered through the New York State of Health. There's also been, again, other action taken by the Trump administration, regulations that were proposed in March that also relate to marketplace coverage, and some action that we've seen in the House Energy and Commerce bill that overlaps with some of these policies. The New York State of Health's own estimates there note that these policy changes would likely raise premiums by 4.5%, and also result in disenrollment of at least 6,000 fewer QHP enrollees in the New York market. So I know that was quite a lot to go through in a short amount of time. As I mentioned, we'll be digging a little bit deeper in several of these areas that Elizabeth will pick up on. We have a few resources too that I will just pass over very quickly, and for folks who, I know there were some questions, you'll be getting this slide deck as well, so you'll be able to click through to all of these. But the 50 state analysis that I mentioned up front on some specific modeling work on Medicaid cut impacts information is available here. You'll be able to click through to get to the more detailed analyses, as well as an issue brief and an executive summary. And then for some further breakdowns around what's happening in terms of the latest on Medicaid actions, Manad is also developing and curating a set of different newsletters around this topic. A few of the more recent ones you can see here, and this provides sort of the quick takes around very complex areas.
Great. Thank you so much, Alice. I'm going to turn it over to Elizabeth so we can dig in a little bit to some of the New York specifics. Elizabeth, I'll turn it to you.
Okay.
And I will get to your next slide. Yeah, thank you. Okay.
Can you hear me okay? Can you hear me okay?
Yep.
Great. So my job is to tell us about this really difficult reconciliation process that we're now embarked upon. This is a different and an unusual method for securing budgets federally, but it has become more and more the norm. And the reason why Congress is shifting to this reconciliation process is that you only need a 50-50 vote, over 50 vote senators in the Senate. And so that's an important thing to understand, but it's sort of an awkward process. And we're right here where that little kind of orange star is. In April 2025, the House and Senate adopted the same budget resolution, which has contained these reconciliation instructions. The Energy and Commerce Committee actually surpassed its goal, and they're proposing $912 billion in cuts. They were only supposed to do 880, so that's sort of I'd say a half step back. And the outlines were released last night, which they were required to under their process. And they're going to start marking up and voting on Tuesday. After Energy and Commerce, it goes to the Budget Committee in the House and then the other chamber. And then those committees will receive directives to vote. That is expected to go to the House Budget Committee by the 16th of this week. And then they're expected to do floor action, like floor vote actions next week. I think it would be very good for everybody to breathe and to in Washington, D.C. and take a minute. These are really big action items that are going to have a huge impact on certainly New Yorkers' lives, but many, many more real people's lives throughout the country. And 13 million, quite honestly, and also would really impact the economy overall, because healthcare is one of the biggest economic drivers in our country right now. So the next thing that would happen is the two differences in the House, the two chambers will have to be resolved between the chambers, and then they vote. And if agreement can be happened either through a conference committee, an exchange of amendments, one chamber passing the reconciliation and the other without any change. So there's a whole bunch of like procedural things that can keep happening, but I'm going to move on. There's a lot of articles about this. Next slide. So the Energy and Commerce Committee, this is where we are. They basically oversee $25 trillion. As you can see, Medicaid's a huge portion of that $25 trillion. That's the chart on the right. They released a bill yesterday that would cut $900 billion. So some of that's like environmental and some other transportation issues, but the bulk of these cuts are happening to them, or would happen to the Medicaid program. This bill, and it's really the second bullet, it's so important to understand. This bill will increase the number of uninsured by an estimated 8.6 million nationally by 2034. And then combined with the CMS rule that they seem to be codifying here and the expiration of the Affordable Care Act enhanced premium tax credits, the numbers of uninsured Americans should increase up by at least $13.7 million. And that's the Congressional Budget Office that has come up with these things. So we're really concerned that the worst case scenario is about $880 billion will be cut from the Medicaid program, which would be almost a tenth of our entire nation's Medicaid budget, which, you know, it's very ironic that we are cutting healthcare for low-income people to do what? Why do we have to raise all this money? It's to fund tax cuts for wealthy Americans. And I think it's really important for everybody on this call to understand that is why they are trying to cut the budget. It isn't that they're cutting the overall budget. They're cutting it to actually provide more tax relief to wealthier Americans. Next slide. So this is sort of the roll-up of Alice and my slides together. You know, so it's not a horrible story on some level. We've made a difference, all of us together. A lot of really horrible things that they were proposing to do are no longer on the table, like basically just reducing the funding to have the higher level Medicaid income. And I say higher level, it means up to 138% of poverty. That means a single person making $21,000. That means it's a retail worker, a low-wage worker, a part-time worker. These are not wealthy folks that are working using Medicaid. And then some of the other things, we got rid of the per capita cap. Yay! That would have really hurt New York because, of course, our Medicaid spending per person is much higher than elsewhere in the country. That said, they have decided to accept a bunch of the proposals that we think are really quite not great, and those are in the golden rod here. And one of the things is that they really are going out to punish New York State for covering undocumented immigrants with, limited coverage. And we can talk about that on the next slide. So here are the Medicaid cuts, and this is the roll-up of what we understand. So about 8.6 million people will be impacted, will have their coverage. When I say impact, they will have their coverage cut. So the first thing they want to do is have work requirements for people, about 80 hours a month. We'll talk about that some more later. I have a slide about that, but the next thing they want to do is they want to cut New York's Medicaid funding. Federal FMAP means federal Medicaid matching funds, and they want to cut that by 10% because we do use our Medicaid infrastructure for immigrant enrollment into Medicaid for pregnant women, older people who are over 65. We do provide Medicaid coverage for undocumented immigrants over 65, and we provide emergency Medicaid. And so does the rest of the country, by the way. So I think every state will see actually an FMAP cut by 10% because I think almost every state uses Medicaid to fund their emergency Medicaid program, which is required by law. The next thing is they want Medicaid, Medicaid cost sharing. I'll try to hurry. Am I going too slow? They want Medicaid cost sharing requirements. So these are very low income people to have to pay $35 per service. Basically makes using Medicaid almost impossible for many, many people. And that's for people that make over $15,000 a year. That's pre-tax, by the way. They want to freeze new provider taxes. They want to cut the Medicaid. Medicaid right now, if you enroll and at the hospital, because you were hit by a car, you can have coverage back for 3 months. They want to reduce that retroactive Medicaid eligibility from 3 months to 1 month. They want to prohibit Medicaid funding for gender affirming care for minors. They want to stop reimbursing community health providers that provide family planning and abortion services through this bill. And they have lots and lots of things that'll make it hard for people to stay on Medicaid. Eligibility of verification requirements, for example, every 6 months, making someone go through a meaningless process to keep saying that they want their Medicaid coverage. Next slide. Somebody in the chat had asked about, well, what about the marketplace? Well, that's horrible. They want to do also for the marketplace. 5.1 million people are expected to lose coverage. And I want to just point out that many of the things that they now are codifying in the CMS proposed rules will damage our individual market. It'll make it only the very sick people will have the incentive or the wherewithal to keep in coverage, and it will scare off a lot of healthier people. So one thing they want to do is raise premium costs by 4.5% because of all these different rules. That's the impact of it, which is about $300 per member per month for an average family. It would also, as Alice pointed out, they'll reduce enrollment for 6,000 people. They want to codify the shortened of, right now our open enrollment is around 3 months, 2 months, I'm sorry. They want to codify that to 45 days. First of all, it's very hard for New York physically to enroll people in coverage so quickly. I'm sorry, I think it's just 30 days. They want to close that open enrollment period to a very shortened time, almost half of what we currently do. That will mean only this, again, that when they have the longer open enrollment period, a lot more healthy people come in late. There's a bunch of procrastinators apparently. And so we want to embrace our procrastinating New Yorkers and get them into coverage. We don't want a shorter open enrollment period, and also no coverage for the dreamer population. And then the other thing that it will still to come is, we think it looks like they're going to encourage the termination of the enhanced and premium tax credits. That's 140,000 New Yorkers that benefit from that. We could lose 50,000 enrollees in our individual marketplace if they lapse, and then who knows what's going to happen with the essential plan. Next slide. So I want to talk a little bit about this work requirement, because it seems like they're really going to go for it. So a lot of Americans don't have access to employer-sponsored insurance, especially low-income people who are likely to be eligible for Medicaid. Let's take service workers. Less than half of our service workers, and these are people that are even wealthier income, because service workers can have all sorts of incomes, but less than half of them actually have access or even offered job-based coverage. Of those, of all the people who are in service workers, only 21% are able to pick up their coverage. And then for part-time workers, another demographic that's very commonly enrolled in Medicaid, it's even fewer part-time workers are actually offered job-based coverage. And so only 11% of those pick up. So why do we talk about this? Well, we talk about this because their point is, oh, we should have people working. Well, people are working. They just can't get coverage through their jobs. And that's especially true in a high-cost state like New York, where we have the second highest health insurance premiums in the country. Our healthcare costs are the second highest in the country. There is no job-based coverage. And so the whole idea of cutting people and putting people on these work requirements is for them to go get jobs that have health insurance. But those jobs don't exist at these income cuts. And I think that's something we really need to push back and make sure that our members of Congress, who are so pivotal in this discussion, understand it. Next slide. So who is on Medicaid? Well, 44% of the folks who are on Medicaid are working full-time, right? So 20% are working part-time. These are the people that do not have good job-based coverage options. That's why they're enrolled in Medicaid. Why are people not working? The very few people, so that's 64% of the people already are working. So why are we putting work reporting requirements on them? I don't know. But on top of that, the very few people, whatever that is, oh my God, math, 38% of people who are not working, they have really good reasons. 12% are taking care of family members. 10% are ill or disabled. 6% are going to school. Retired, 4%. 2% can't find work. 2% we truly don't know. So why is it a bad thing to have these work reporting requirements? Well, it's expensive to reprogram our IT system. Quarterly renewals or twice a year renewals will increase the uncompensated care burden that we all pay for our hospitals and clinics a lot. It will mean we'll have bigger wait times in the emergency rooms. So bottom line is 48% of New Yorkers work full or part-time. They are at risk at losing income, losing their Medicaid. And I don't say this frivolously. Apparently in Georgia, where they imposed work requirements, they saw when they did their Medicaid expansion, they expected 100,000 people would get coverage when they did their expansion that included the work requirements. Only 4,000 did. So it's devastating. We know what's going to happen with work requirements. People are going to lose coverage. And finally, P.S., low-wage workers do not have access. Why is it so hard to comply with work requirements? Because people that are working low-wage jobs, hard time getting their bosses to provide letters proving that they work. Hard time having broadband in their communities to upload these documents. Having to go to a Medicaid office in person where you lose a day's work because you're sitting around waiting for some worker to come and photocopy your proof just makes it impossible for people to do. And so this really will mean that eligible people are going to lose their coverage. Next slide. I'm done. Yay.
Thank you, Elizabeth. That was great. So we'll turn it over to Lara to talk to us a little bit about some of the work that's been happening with partners on the ground.
Thank you, Avital. And I'm so grateful for Alice and Elizabeth and other partners and colleagues in New York who are, able to bring the real deep, important knowledge of the content to these discussions. And my job today is to bring it back to the comments that Avital made at the beginning about remembering why we're here and why we're doing all of this. And that is because of the New Yorkers who have Medicaid for their health insurance coverage. Medicaid Matters New York is the statewide Medicaid Consumer Advocacy Coalition, and really core to our mission is making sure that we bring the importance of lived experience to everything that we do. We do that in a variety of ways, and over the course of our 20 plus years of history, we have really evolved to doing this work in a very much more consistent and meaningful way. And the importance of bringing stories to the work has been woven throughout our advocacy and our awareness raising generally about the importance of Medicaid. Next slide. So a few years ago, we published a stories book called Why Medicaid Matters to Me, 5 New York stories. You can still find it on our website. Next slide. And the next couple of slides are examples of New Yorkers who have volunteered to share their stories about the importance of Medicaid to them. This is Michelle in New York City. The next one is Sharon, who is also in New York City. And we use these stories throughout our work, as I said, raising awareness about the importance of Medicaid. We do produce, budget analysis and memos on legislation and, focusing on details of how Medicaid policymaking and budget making impacts on New Yorkers. And important to the work is making sure we include the stories of people who are impacted by policymaking in New York. Next slide. So now we have brought the importance of Medicaid to New Yorkers to the federal fight to protect Medicaid from all of these federal cuts that Alice and Elizabeth have been talking about this morning. This afternoon. So here are some examples. These folks have graciously volunteered to share what Medicaid matters, why Medicaid matters to them. We have tried very hard to make sure that we ramp up our story collection efforts throughout the state so that we can demonstrate this is not a New York City issue. This is not an urban issue. This is not anything other than Medicaid insurance coverage for New Yorkers across the state. And we've been able to do that by reaching out to colleague organizations, individuals who we know, and people who we think will help us do this work to bring the importance of Medicaid to this fight at the federal level. So these are the stories of Maggie, who lives in Congressional District Number 5, represented by Representative Gregory Meeks. Kathleen, who lives on Long Island, who's represented by Representative Laura Gillen, and the Reverend Dr. Philip Fleming, who lives in NY23 out in Western New York, represented by Representative Nick Langworthy. Next slide. We've also recently decided we should consolidate these into something that's easy to use. So you'll find on our website, there is now a document that is a front and back document that features, I believe it is 11 stories of New Yorkers from across the state. And the heading says it all: Medicaid matters to residents in all New York State congressional districts. We are trying to demonstrate the importance of Medicaid to people across the state, urban, rural, people with disabilities, families, you name it. We are trying our best to bring the importance of Medicaid to all of the awareness raising and education that we are doing about how these changes could impact New Yorkers. We are, through some generous funding that we have now, have been able to dig real deeply into the data on how these potential cuts that we may see happen as early as tomorrow, or a vote approval happen as early as tomorrow, how cuts would impact on specific districts, the House districts. There are 26 House districts in New York. And so we were able to produce fact sheets for each of those House districts. You'll find them on our website. And the reason that I mention these fact sheets, of course, is to make sure that you know that they're there. They are meant for you to use as for your own reference. They are also, very easily printed and brought with you to meetings and rallies and whatever the case may be. You could bring it to dinner with your friends, however you want to use them. And we have highlighted a story of a New Yorker on each of the fact sheets. That was very important to us when we decided to take on this project, to bring data specific to each of the House districts. We wanted to make sure that we included a story of a New Yorker. In most cases, it's a constituent of each of those districts, but we wanted to make sure we brought a story of a New Yorker to each of those fact sheets. And then we, of course, want to provide ways for you all to get involved. So how do we have all these stories? It's because we work really hard to get them. We work with partners across the state. That means other coalitions, other organizations, both within the Medicaid Matters Coalition and outside of the coalition. We have been doing outreach on a regional basis with individual advocates, individual organizations. And the tool that we are using is a form that is very easily used. We've tested it years ago when we started using SurveyMonkey. We tested it with individuals to make sure that we chose something that would be easy to use, very easy to use from a smartphone. And it allows us to have an easy, quick way for people to provide their own story. So please use that link. You can tell your own story. You can, if you are a clinician or a community-based provider and you want to talk about the importance of Medicaid coverage to the people who you work with, the people who you serve, you please use the survey tool. If you are someone who works in an organization that works with people who have Medicaid for their health insurance coverage, we strongly encourage you to use our survey tool to share that widely, encourage people to tell us about why Medicaid matters to them so that we can bring their stories to this work to defend Medicaid at the federal level. And then you'll see there we have all of our district specific fact sheets on our website. We have a federal issues page. Along with the fact sheets, you'll find a variety of other materials and resources. And then lastly, I wanted to end with a slide featuring our friend BJ Stasio in Western New York. He lives in Buffalo. He recently participated in a town hall with congressional members. And just off the cuff, this is what he said. You know, he had a couple of minutes to share his story, and off the cuff, he said he was kind of ending his time, and he said, Medicaid is not a hand up, it's a hand, I'm sorry, I ruined it. Medicaid is a hand up, not a hand out. And I said, hey, can we use that? That's phenomenal. He just came up with it off the top of his head. And now we are using this graphic with his permission because it is a powerful message. And we need to make sure that we can deliver the message of the importance of Medicaid and what the impact of these potential cuts could be to New Yorkers across the state. Thanks.
Thank you so much, Lara. And thanks to all of our speakers. I'm going to stop sharing. So I know we covered a lot of ground, and so I'm sure people have various questions. As we said throughout, we'll be sharing the slides and resources after, so you can dig into them. But we have time for some questions. I've been taking a look at the chat. I wanted to first throw out to Alice and maybe Elizabeth, if you could just share a little bit more. You talked about what happened over the weekend. Elizabeth, you gave us a little bit of a look ahead timeline. Can you share a little bit about what people should look out for in the next few days, what could change, what might not change, so that people can kind of react to that?
Sure, yeah, I'm happy to start. As we sort of noted, hot off the presses is the bill text that came out from the House Energy and Commerce Committee, which has more of the details behind the policy changes that are being proposed to meet this, 880 billion cut in terms of the federal budget, a large amount of which are focused on the Medicaid program. We still expect that there may be, another amendment to this language coming out as soon as today. There's a scheduled markup at the House Energy and Commerce Committee level tomorrow at 2 p.m. It's anticipated to be a lengthy markup, given the volume of material here, where there will be more discussion and work on these provisions in this language. So it is also at a critical period in terms of communicating about the impact of these provisions and what they will mean to Medicaid and our other public coverage programs. As Elizabeth noted, we're in the midst of this reconciliation process, where this is one sort of step in the middle of the process to further advance what these policy proposals could look like to meet that savings target.
Great, thanks. And then there's a few, actually, as I asked the question, there were a few
Wait, I would
questions.
just,
Yeah, can you add in, Elizabeth?
I would add one more thing to
Yeah.
Alice. Perfect roll up, Alice. The only thing I would say is I think CBO, the Congressional Budget Office, will be issuing a score, and
Yep.
I think that's in the next 24 hours, and that's extremely important to be watching for, because that's how much money they're going to make, and it's profound. And I would just also encourage, this is the moment. If you are concerned about this, there are lots of ways to reach out to your members. You can go to our website. We will facilitate reaching out to, public officials and explaining the importance of Medicaid to you and how you might feel about these proposed cuts. So Community Service Society of New York, it's right there on our homepage if you want easy access to your member.
And I think as I was asking the question, there were a few comments in the chat kind of digging in a little more. Anything around your sense of kind of the Senate review portion of this process, and also, is at this point is the reconciliation process, forging ahead? There's no way that stopped, right? That train has left the station. Those two questions were in the chat, both about Senate and kind of the reconciliation process writ large.
Look, we've already made a huge impact. We have, the original proposal was a 2.4 trillion. So never say never.
Yeah.
Right now we're down to 880 or 900 billion. Like, we are making a difference, but we must speak out. We must be speaking out to the press. We must be speaking out in our editorials and our letters to the editors. And we must be, explaining to our members that this is not okay. Medicaid is not a handout, it's a hand up. And, this is health coverage. We are talking about health coverage. What is the point of cutting people off of health coverage. There's no good point, especially when the only reason to cut these people, our people, from health coverage is to pay for tax cuts for the rich. That is not a good enough reason. And I think we just need to explain over and over again, hands off Medicaid. This is our and Affordable Care Act too, by the way. This is health coverage. What is the purpose of cutting people off of health coverage? There is no good purpose of doing that.
Great, thank you. And kind of actually turning to that next question about that, maybe Elizabeth and Lara, you can share a little bit more about kind of what's happened in the state in terms of mobilization, partners coming together. You shared a bit about the impact of that, but how different partners have been working together in this last several months.
Sure. I mean, a bunch of statewide groups have been getting together in this New York Coverage and Care Coalition, and we are all putting together, for example, just in terms of reaching out to the media, little statements from every single one of these groups. We will have them available, if in a consolidated way if people want to participate, and we'll have that ready and sent out to the press by tomorrow. I think what we really want our elected leaders to understand is this is outrageous. People do not believe in healthcare cuts. It is not popular. They are doing it over opposition from the people, from the economic sectors like hospitals, health plans. No one likes this. The only people that like this is that Steve Bannon doesn't like this. I mean, so I'm not sure who does like this, but maybe Elon Musk. But very few people want healthcare cuts. This is health coverage. It's a helping hand up.
Thanks, Lara.
Thanks. And the other,
add?
yeah, thanks. The other thing I'll add is, there are over 300 people listening in. And if you or the folks you work with or the organization you work for isn't yet doing this work, you do not need to recreate the wheel. There are lots of materials. There are ways to connect to the activity that's already happening. You can reach out to Elizabeth or me or anyone else who in the Medicaid space to get involved in this work. We are all working together. Elizabeth and I touch base several times a week. There are many groups working on this together. And there are many ways for people to get involved. So if you are interested in getting involved, I think that's an important takeaway, I hope. It's easy to plug in. It's easy to get the resources and the tools that you need to participate, whether it's telling your story, picking up the phone to express what you think the importance of Medicaid is to your district, to where you live, or a letter writing campaign, or writing letters to the editor, whatever the case may be. There are resources and partners out there who are ready, willing, and able to plug you in and help you help us work together to do all this work.
Great, thank you. And Alice, just quickly before we round up, because we don't have that much time left for questions, is there anything that you've seen happening in other states with your work or at the national level that people should be keeping their eye out for?
I think just to also highlight that the state sort of leadership level has also been an important area of engagement. What we've seen across other states as well is state governors commissioning their own specific analyses, or state Republican legislators reaching out to their federal counterparts also as messengers. We've seen that in Utah to speak to the impacts of these program cuts to their state.
Great, thanks. We have one more minute left. I don't know if anyone else wants to kind of share a closing thought. What I would say to everyone listening in, there were a handful of questions, things about kind of some of the Senate decision making, the Supreme Court actions, potential actions, and things like that. We'll try to compile those questions and either follow up or you can follow up with us. We also will be making sure to share all of these resources, links to the story collecting and that type of thing. But is there any closing thoughts that Lara, Elizabeth, or Alice you want to share with the group in terms of the next few days or other resources they should have at their fingertips? I think we covered a lot of it. Great. Okay. So much more to get into. If we had another hour, we would dig into each topic. But this has been so helpful. In many ways, we landed on having a bit of a briefing from this weekend's action. And so I really appreciate the panelists coming to give us all kind of the play-by-play and the up-to-date information. I hope it was helpful for everyone listening in. Please feel free to reach out to us, and we will share everything pretty quickly so you have it in hand for over the next few days. And keep a lookout for our announcements for upcoming webinars on this and other topics. So I'm wishing everyone a good afternoon, and thanks so much.